Please now welcome our next speaker, Tyler Griesi, and his thesis, Repairing Healthcare, Why the United States Should Adopt a Single-Payer Healthcare System.
An exhausted breast cancer patient lies on a stiff hospital bed. Tubes are connected to the needles in her body, constantly pumping fluids. The sound of her heartbeat fills the room as a life monitor device beeps and beeps and beeps. A doctor abruptly opens the door, bearing bad news. The patient's chemotherapy had caused cardiac damage. The physicians concluded that a heart transplant was necessary. However, the patient was rejected by the hospital for this operation. Why? A Michigan hospital committee sent her the following message. The decision made by the committee is that you're not a candidate at this time for a heart transplant due to needing a more secure financial plan. The committee is recommending a fundraising effort of $10,000. The patient now has to pay for a heart transplant procedure on top of the chemotherapy she was already paying for. Such was the case for Hida Martin, who was told to beg for her life on a website like GoFundMe. Why is the health of millions of Americans like Hida Martin in jeopardy? Millions of Americans are uninsured in the current healthcare system and suffer from the burden of expensive medical costs. Often, patients cannot afford these costs and do not receive the care they require. Why is the sum of Hida Martin's medical costs so astronomically expensive? How can healthcare in America be more efficient, effective, and affordable? A single-payer healthcare system should be implemented in America because it would provide a uniform standard of care among the population and reduce healthcare costs. In a single-payer system, the government will administer all healthcare funding and payments in order to secure efficiency, effectiveness, and affordability. This secures the promise of the Declaration of Independence because the inalienable rights of the uninsured citizens will no longer be infringed upon. Healthcare in America is tremendously and unnecessarily expensive. As of this year, 20% of gross domestic product is spent on healthcare, and this number is constantly growing. Medical care requires significant funding due to its advanced technology. Nonetheless, there are still methods to reduce total healthcare spending. Drug prices have become inflated due to the lack of competition between companies. Hospitals and providers continue to merge and dictate the price of medical care. Further, the complex network of insurers and other systems have increased administrative costs through countless regulations about billing, coding, and usage. Both drug prices and administrative costs have been a substantial factor in healthcare spending, contributing up to 1/3 of total spending. However, a single-payer healthcare system will reduce both administrative costs and drug prices. This is because the government will control where all healthcare funding is directed. Hence, pharmaceutical companies will only receive business if they comply with the government and negotiate affordable drug prices for patients. The Congressional Budget Office estimates this would save up to $450 billion. Also, administrative costs will be reduced by replacing the complex network of insurers with a single-streamed provider. This allows the government to create a transparent and standard regulation system regarding billing and usage. An Annals of Internal Medicine report predicted this process would yield $600 billion in administrative savings. Thus, both administrative simplification and drug negotiation will yield copious savings. Another issue with the current healthcare system is how it treats healthcare as a commodity and leaves millions of Americans uninsured. Gerald Friedman, an economics professor, sees healthcare as an intrinsic right, embodying the national commitment to life, liberty, and the pursuit of happiness. This is because healthcare is essential for a life of dignity. When Americans are not insured, they suffer consequences that are detrimental to their health. injury, illness, or disease will restrict the patient of their ability to exercise their inherent right to life, liberty, and the pursuit of happiness. This is unacceptable because the government should protect and promote our rights and put an end to this fragmented system. On the contrary, a single-payer healthcare system will cover every citizen regardless of pay. This would restore equity and justice in healthcare. Thus, the government must implement a single-payer system in order to secure the rights of the citizens. How would such a large-scale system be funded? A tax system is the best funding mechanism for a single-payer system. David Colton, a retired healthcare administrator, recommends a transaction tax on the sale of goods, financial transactions, and services, along with an excise tax on the sales of items that contribute to health problems, such as tobacco, marijuana, and bullets. The funding gained from this tax system would provide medically necessary services to every citizen. These services would focus on prevention, long-term care, and hospital care. This ensures access to a basic standard of care among the whole population. Some may object that a single-payer tax system will be an effective funding mechanism. Rather, critics argue that a single-payer tax system will be too expensive in order to create an adequate amount of revenue. However, a public library of science analysis predicted net savings of 3.5% in just the first year after implementation of a single-payer system. Furthermore, up to 27% of these savings were due to lower administrative costs and drug pricing. This proves that a single-payer tax system will be effective and total healthcare costs will be reduced over time. In conclusion, the status quo of healthcare in America is in a crisis. Health reform is necessary. A single-payer tax system is the best solution because it would reduce medical expenditures and provide healthcare to every citizen. Economic productivity would thrive. American society would flourish. Equity would be restored in healthcare. As an American citizen, it is our duty to use our voice and votes in order to help shape this country. Millions have gone bankrupt and become victims of a cruel system that prioritizes profit over care. Thousands have died, having fallen short of a medical bill. Corruption stains our current healthcare system. America is at risk. We are at risk. When you hear single payer, think of patients like Keita Martin, who will no longer be neglected of the care they need to survive. Healthcare can no longer be a luxury. It is time to repair healthcare. Thank you.